Hi, welcome to Daily Dose. Today we're bringing you a top 10 list of the skin diseases out there.
These conditions can be incredibly serious and even life-threatening.
So it's important to be aware of them and seek medical treatment if you suspect you may have one.
Without further ado,
Let's get started. Number 10. Stevens-Johnson syndrome. This rare but severe skin condition is often triggered by a reaction to certain medications. It causes painful blistering and peeling of the skin, as well as symptoms like fever, fatigue, and a sore throat.
And a red or purple rash that spreads and blisters. The rash can also affect the eyes, mouth, and genital area. Stevens-Johnson syndrome can be serious and even life-threatening, as it can lead to dehydration, infections, and organ damage. It's important to seek medical attention immediately. If you think you may have SJS, most people with SJS recover fully, but it can take several weeks or months for the skin to fully heal. It's also possible for SJS to cause scarring or changes in skin. Number 9. Toxic epidermal necrosis. This is another rare but serious skin condition that is often caused by a reaction to medication, but it can also be triggered by infections or other underlying health conditions. Symptoms of toxic epidermal necrosis include fever, painful blisters, and widespread peeling of the skin. The condition can affect any part of the body, but it is most commonly seen on the face, neck, and upper trunk. Can also affect the mucous membranes, such as those found in the mouth, nose, and eyes. It is important to seek medical attention right away. If you suspect you may have toxic epidermal necrosis, early diagnosis and treatment can improve the chances of a full recovery. Number 8. Necrotizing fasciitis. This rare but serious infection causes the skin and the tissue underneath it to die. It's often referred to as flesh-eating bacteria because of the way it eats away at the skin. Necrotizing fasciitis can spread quickly and can be life-threatening if not treated promptly. Number 8. Erythema multiform. This skin condition is often caused by a reaction to certain medications or infections. It causes red raised lesions on the skin that are often shaped like circles or inks. Erythema multiform can be mild or severe, and in severe cases, it can lead to blisters and ulcers on the skin. Number 6. Cutaneous T-cell lymphoma. The most common type of CTCLL is meiosis fungis, which typically begins as a rash or red patches on the skin. As the disease progresses, it can cause thicker patches or plaques, and eventually tumors on the skin. CTCLL is usually diagnosed through a biopsy, where a sample of affected skin is taken and examined under a microscope. The tests such as a blood test or imaging scans may also be used to assess the extent of the disease. Treatment for CTCL varies depending on the stage of the disease and the specific needs of the patient. Options may include topical creams, light therapy, chemotherapy, or other medications in advanced stages of a stem cell transplant may be necessary. It's important to work closely with a healthcare team to determine the best treatment plan for you. Number 5. Melanoma. Melanoma is a type of skin cancer that occurs when melanocytes, the cells that produce pigment in the skin, grow out of control and form a tumor. It is typically characterized by the appearance of a regularly shaped mole or patch on the skin that may be black, brown, or multicolored. Melanoma can occur anywhere on the body, but it is most commonly found on areas that receive the most sun exposure, such as the face, neck, arms, and legs. It is important to regularly check your skin for any new or changing MO, as early detection of melanoma is key to successful treatment. Risk factors for melanoma include having fair skin, a family history of the disease, and a history of excessive sun exposure or sunburns. Using sunscreen and protective clothing can help reduce your risk of developing melanoma. If you suspect that you may have melanoma, it is important to see a dermatologist as soon as possible. Treatment options may include surgery to remove the cancerous cells, chemotherapy, and/or radiation therapy. Number 4. Squamous cell carcinoma. This is another type of skin cancer that begins in the cells that make up the outer layer of the skin. It can appear as a firm red bump or a rough scaly patch. Squamous cell carcinoma can be life-threatening if not treated promptly. Number 3. Basal cell carcinoma. Basal cell carcinoma is the most common type of skin cancer. It's usually found on the face, neck, or scalp, but it can occur anywhere on the body. Basal cell carcinoma begins in the basal cells, which are the cells at the bottom of the outer layer of the skin. These cells produce new skin cells as old ones die. Basal cell carcinomas often appear as small pink core flesh-colored bumps on the skin. They can also appear as red patches, open sores, or scarce. They tend to grow slowly and rarely spread to other parts of the body. The main cause of basal cell carcinoma is exposure to ultraviolet UV radiation from the sun or tanning beds. People with fair, blue or green eyes or red or blonde hair are more at risk for developing basal cell carcinoma. Basal cell carcinoma is a treatable form of skin cancer by protecting your skin from the sun and getting regular checkups. Number 2. Capsis SAR-CAP. Capsis sarcoma is a type of cancer that affects the skin and mucous membranes. It is caused by the human puppies virus, also known as 8 of 8. The most common symptoms of Capsis sarcoma are purple or red patches on the skin or mucous membranes. These patches, also known as lesions, may be raised or flat and can appear anywhere on the body, but are most often found on the legs, ankles, and soles of the feet. Capsis sarcoma can also cause swelling in the lymph nodes and internal organs as well as fatigue. Weight loss. There are 4 types of Capsis sarcoma: classic African immunosuppression, associa, and epidemic. Classic Capsis sarcoma typically affects older men of Mediterranean nor Eastern European descent and is slow growing. African Capsis sarcoma is more aggressive and typically affects young people. In sub-Saharan Africa, immunosuppression-associated Capsis sarcoma can occur in people with compromised immune systems, such as organ transplant recipients or people with HIV/AIDS. Epidemic Capsis sarcoma, also known as AIDS-related Capsis sarcoma, is the most aggressive form and primarily affects people with HIV/AIDS. Treatment for Capsis sarcoma may include chemotherapy, radiation therapy, or immunotherapy. In some cases, surgery may be necessary to remove the lesions. The prognosis for Capsis sarcoma depends on the type and stage of the cancer as well as the overall health of the patient. And finally, number 1. Acute generalized eczema, erythema or AGP is a rare and serious skin condition that is characterized by the sudden development of widespread pustules or small pu-filled bumps on the skin. It typically occurs after the use of certain medications such as antibiotics and can be life-threatening if left untreated. Symptoms of AGEP may include fever, chills, and severe itching. In addition to the pu jaws on the skin, it is important to seek medical attention if you suspect you may have AGEP, as it can progress quickly and may require hospitalization. Treatment for AGEP may include the discontinuation of the medication that triggered the conduct, and the use of steroids or other medications to control inflammation and manage symptoms. If you have been prescribed a new medication and develop sudden widespread post-jaws, it is important to contact your healthcare provider immediately. Thanks for watching our top 10 list of lethal skin diseases. If you enjoyed this video and want to see more like it, be sure to hit the subscribe button and the notification bell so you don't miss out on any of our future content. We appreciate your support and can't wait to bring you more interesting and informative videos in the future.